There we go. So yes.
All right.
You
So I
are.
can start. My name is Kim, or Kimberly, either is fine. I'm one of the doctors at Swedish Family Medicine resident, here with a couple of my colleagues. Thank you so much for having us here today. We are so thankful for this opportunity to learn from you and just share some of the things that we've learned along our way for learning to become doctors. So I'll hand it over to Amelia in just 1 second. I'll be sharing my screen, and we'll have some slides from a presentation, and then we're gonna send the presentation slides as well to Claude, and there's a list of resources as well, so don't feel like you have to take notes or anything like that. So Amelia, go right ahead.
You.
Hi everyone, I'm Amelia. I am another resident doctor at Swedish First Hill Family Medicine residency, and I'm really excited to be here and meet everyone, and hopefully continue this collaboration forward. So, and then we also have Maya.
Thank you.
Hello, I'm Maya. I'm another resident physician at Swedish Family Medicine. We're all at different clinics within the same residency. I'm at the Ballard one, Amelia's at First Hill, and Kim is at Downtown Family Medicine. So we know about resources a little bit throughout the city. I believe that's it. We can get started.
All right, so I'm gonna just share my screen. Oh, Claude, is it okay if I share my screen? It says I have to wait for you first.
Okay, so I'm going to make you call, I think. Which one of you are going to be sharing screens? So
I will be.
Oh, you'll be? Okay, so I'm gonna make you
Co-host, awesome.
There you go, there you are.
Okay, so here we go, slideshow. All right. So today we're going to be talking about preconception counseling. So basically, everyone can benefit from chatting to their doctor or chatting with friends or families before deciding to get pregnant, whether it's soon or later on. So this will be a relatively brief presentation. Feel free to ask questions as you go, as we go, and then also we'll have an opportunity to answer as well as we go on. So I will start off. So essentially, you can always have a visit with your doctor whenever, even if you're not pregnant yet. So being able to talk with your healthcare provider to kind of just even talk about pregnancy, to go over like medications that you might be on, medications that maybe you should be on, your blood pressure, any other kind of chronic diseases, talking about vaccinations. And these are some of the things that we're actually going to be covering over today. But just know that your health provider can be there to support you even before you get pregnant. And this I find is very beneficial. I feel there's so much information out there in the community, online, and just being able to talk to a provider about those things that you hear has been very helpful for some of my patients personally.
So, like Kim was saying, I think thinking about getting pregnant can be an opportunity to make sure your body and that you are as healthy as you can be, so that your pregnancy can go as smoothly and your baby can be as healthy as possible too. And that this can be at any time before pregnancy, but there's some things before pregnancy that can be easier to get under healthy control or make changes with than kind of while you're already pregnant. So this can be an opportunity to do those things. One thing, if you go to your doctor to talk about getting pregnant, or just to think about, is if you have some sort of disease already that you take medication for or manage, it can be good to make sure that that is under good control and that you're kind of managing that as best you can. So a couple really common ones, diabetes if you have really high blood sugars, then it can sometimes be harmful to your pregnancy and to the baby developing, and cause some complications in pregnancy. So making sure that you're eating healthy and you have good nutrition, controlling your sugars like that, or maybe starting or changing any medications, to make sure that your sugars are in good control. Another common disease people have is high blood pressure that can also sometimes get worse during pregnancy, while your baby is developing, just because of all the changes your body goes through. And sometimes if your blood pressure is really high, it can restrict your baby's growth and prevent the blood flow to the baby in a healthy way. So that can also be really important to make sure. You might need to start medications or just keep closer track of it when you're pregnant. And then another thing is thyroid disease is a common problem people might have and not even know about it. And that's the gland at your neck that can control hormones in your body. And so that might be something that your doctor might want to test for. And sometimes it can be a problem in pregnancy and then it can kind of get better after pregnancy, like many other things. So that can be another thing that you might want to check on before you get pregnant.
And if you already have a chronic disease or something that you see your doctor for regularly, double check before getting pregnant whether or not the medications that you take to manage your diseases are also safe in pregnancy. For example, if you have elevated blood pressure, there's certain categories of medications called ACE inhibitors like lisinopril, which are very safe medications when you're not pregnant. But if you were to get pregnant on those medications, they can cause some heart defects in the baby. There's also some medications that people take for their mental health that can have effect on development of different organs in the body. And so double checking that everything you're taking is also safe during pregnancy can help prevent any adverse outcomes or any malformations of any organs. But we always recommend that you talk to your doctor about switching as opposed to just stopping your medications, because there's almost always a safe alternative.
Okay. And so infections are something else that you can talk to your doctor about. So this might be something that you have had, but doesn't really cause any problems when you're not pregnant. But if you are pregnant, it can. And so one of those things could be, for instance, like urinary tract infections. So sometimes when people have that, like the burning when you pee or urinate, but sometimes we give antibiotics for it. Sometimes people will clear it on their own, but during pregnancy, we want to make sure that we treat all infections so they don't hurt baby. And then other things that people can live with as well, but have just chronically and not be any on medications are like things like hepatitis B, for instance. And so just making sure that some of the infections that you might be immune to now, but you might not be immune to before you get pregnant. Other examples are measles, which is when you get like a really bad rash. There's also something called mumps or rubella. And even like if we get sick with them, it might not really affect us, but it might have really long-term impacts on your baby's health. So making sure to check to see if you're still immune to some of those infections.
And so that takes us to vaccines, which can be really important before and during pregnancy too. So getting shots to make sure that that you prevent getting any new infections during pregnancy, and then also making sure you can pass along that protection from the vaccine that you get to your baby without, or to your, while you're pregnant. And so, like Kim said, that these are some vaccines that you can get before you're pregnant, but while you're pregnant, it wouldn't be safe to get them. So it's good to get them beforehand so that your baby can be protected throughout the pregnancy and after.
Once you become pregnant, you're providing nutrition both for yourself as well as for your growing fetus or baby. And so it's really important to make sure that you're getting all the vitamins and minerals that you need, as well as all the vitamins and minerals you need to grow a healthy baby. And one of the most important ones for that is something called folic acid. Folic acid you can find in a lot of leafy greens, a lot of vegetables have it, and you can also get it by taking a prenatal vitamin. And we recommend taking a prenatal vitamin prior to getting pregnant. I have many patients who have no intention of getting pregnant but take a prenatal vitamin because they notice it improves their skin and their hair, and it becomes a bit stronger. And taking it prior to getting pregnant is important, especially for the folic acid. Folic acid is important for brain development, and it's most important during the first 4 weeks of pregnancy, which is usually a time people don't even know they're pregnant yet because they may not have even missed their period. And so starting to take a prenatal vitamin or folic acid supplement before you get pregnant can help prevent issues with the developing brain, and you might have the nice benefit of seeing richer hair or less dry skin. There are many different prenatal vitamins, and all of them taste a little bit differently, and it's just really important to find one that you like and you can tolerate, because when people get morning sickness, sometimes they find that they then no longer like the prenatal vitamin that they were taking. But so it's important to find one that you, if that happens, you can find a new one, but just find one that you can take. There's some good gummy ones that people like as well to help with that.
Can I hold on, ladies? Assalamu alaikum, sisters. Please welcome. Is there anyone that needs in translation? Anybody who needed to be translated? Anybody who don't speak the language and wants translation? Please let us know. We will translate for you. gabdho hadday ku jiraan qof oo macnaa aan garanaynin ingiriiska ha hadlo waa idinla turjumaanaya insha allah gabdho badanaa ku jiro oo afka ku hadlaayo ayagaa idin turjumaanayaan oo kamid ah aniga nafsadeeda mindi ku jira qof oo aan fahmaynin ingiriiska okay, we're good. So I asked.
Okay. Yeah. And if at any point, like I said earlier, for those who joined a little bit later, please feel free to interrupt us to ask questions, or if you wanted us to clarify something, we can provide all these slides as well to Suad, so you'll have access to them.
Yeah, I'll share it with you guys, inshallah.
Okay. And so in addition to folic acid, there are a lot of other nutrients that are important. And so these are some of the other 5 nutrients that you can look for in a prenatal vitamin. But in addition to the vitamin, you could also get it through your diet. And so I won't necessarily read through all of this, but basically each vitamin has or nutrient has an important role, not only for your own health, but baby's health as well, whether it's their bones or their heart or muscles or their nervous system. And like I said, I think it's great to get it through the multivitamin, but also through your diet. And so these are just some of the other ones that we recommend. And then the numbers right after the nutrients is how much you should look for each day. So that's a day serving.
So your body is going through a lot when you're pregnant, as you know, and growing a whole human. And when you're thinking about getting pregnant or while you're pregnant, your mind and your mental health are also can go through a lot. And so making checking in about mental health, getting pregnant, being pregnant can be a stressful time. And it can also be a time when your hormones are wild. And so, so that can also add to stress and anxiety and sadness and all sorts of things like that. So making sure that you have a good support network, that you can talk to your doctor or other members of your community about getting extra support, and making sure that you're not just holding everything inside and holding on to that stress. We also have some resources around behavioral health and counseling that we can send along as well, if that's something that people are interested in finding more about.
And there are certain habits that we may have that are especially harmful if we get pregnant. And so two of the main ones for that are drinking and smoking. Other drugs can also be harmful to baby. And so before you get pregnant, if you are someone who happens to drink or someone who happens to smoke, trying to find ways to reduce that you're drinking or smoking, or to cut it out all entirely, can help make it so baby grows healthier. And we recognize that it can be really hard to quit those two things. And so there are often resources that you can talk to your doctor about to help you reduce or stop the amount that you're drinking or smoking or any other drugs.
And these are just some of the resources that we were talking about in terms of helping to reduce any use or possibly quit altogether.
Another important part of being healthy and making sure your body is as healthy as possible is staying active and eating healthy. We talked a little bit about eating healthy and the different types of minerals and vitamins in your food that are really important for a baby to develop healthily. But for activity, before you get pregnant can be a really good time to get, if you're not already active, to get into an exercise program. Aiming for about 3 hours of exercise a week or 30 minutes a day can be really healthy. Whether it's walking, swimming, biking, dancing, can all be really good. And then when you get pregnant, you can your body will be kind of used to that activity, and it can be easier to keep that up while you're pregnant, while your body's changing. And many of us are either over or underweight, and it's important also before you get pregnant to try to maintain a healthy weight. But doing that in a healthy way by getting exercise and eating healthy is the most important thing, rather than numbers on the scale.
And so some tips to do for getting the exercise. Getting in shape and starting an exercise regime before you get pregnant is often the best time. During pregnancy, if you are already exercising, please continue what you are doing. You may notice that your center of gravity may change. So if you're someone who likes to go for runs or does yoga, you may notice you have to make some adjustments to your posture. If you're someone who hadn't been exercising much before you get pregnant, you can still exercise during pregnancy, but we wouldn't recommend, if you haven't gone running in years, to use pregnancy as a time to start and train for a marathon. But starting by doing some walking and then gradually increasing it so your body adapts to the changes as you are. And also be aware that often your ligaments can get a little bit looser in the second and third trimester. You may notice it's a little bit easier to sprain your ankle. You may notice that you move differently than before, in addition to just having the additional weight. And then if you're someone who likes contact sports or exercise that was very high impact, we would suggest avoiding that because you want to avoid any abdominal trauma. So if you're someone who really likes roller skating a lot at high speeds, maybe slow it down and do walking instead. And some other tips that can help are specific exercises during pregnancy called pelvic floor exercises. And these are specific exercises that help strengthen the core, which is your abdominal muscles, as well as your pelvic floor, which is all the muscles that you use when giving birth. And doing exercises to help strengthen those during pregnancy and before pregnancy can make the birthing process a little bit easier and can help prevent some complications after birth, where you might notice that you have a little bit harder time holding in your urine, or you may notice that your abdominal wall is a lot less strong. And doing these exercises before and during pregnancy can help set you up for success.
So there are many places where you can actually get exposed to chemicals that might be dangerous to you and your baby, whether it's actually inside or outside your home. And so kind of main things to avoid inside your home is actually gardening. There are certain bacteria that live in the dirt, but also in like cat litter boxes that can be dangerous to baby. And so trying to ask for help when those things need to be done. Also with cleaning supplies, so just being cautious of that and aware of that. Depending on where you're working, there are specifically chemicals like with laundry mats, and also if you work in a more industrial area, heavy metals that can be dangerous to you and your baby's health. So letting your employer know if you are working outside the home, if you are pregnant, or to make just sure that you have personal protective wear when you're around chemicals.
Can I ask a question about chemical before I forget? How about
Yes.
those who live around places where they cannot help?
Oh,
Like
one sec.
chemicals, like everybody don't have the luxury to live, certain zip codes.
Yeah.
Some live in places where poverty is very, danger to the mother and the fetus and all those stuff. And are you going to talk about later on, like how those moms can, avoid, or what can they do to survive?
Yeah, and that actually brings up a good point. We don't have a specific slide for that, but I think one of the things that we could talk about specifically, like within Washington or just in the SeaTac area, for instance, like if you live in an area where the planes fight over a lot, or if you live in an area close to wildfires, like what are you supposed to do? You can't just move your family, or if you live near like a factory, for instance. And so in terms of that, I found the most helpful things like that you can do at home that is under your control would be things like air filters. And so there are a lot of really great air filters that are available on Amazon or in stores that help filter out some of those toxins, especially during seasons where like you're worried about wildfires, but also being aware of the quality of like the water that you drink. That's something that we didn't put here. In the United States, we hope that the quality of the drinking water is okay, and King County and Seattle in general probably actually has one of the best public water systems in the country. But some things that you can look for if you can't afford to get your water tested is sometimes just investing in a water filter actually can be beneficial. But you bring up a really great point, Swad, and those are things that have been brought up in the legislature and government where people are trying to pass policies to make sure large corporations are held accountable for some of the air pollution or other forms of pollution that affect the environment that we live in.
Thank you.
Another thing we always like to check in with our patients about, but we also want everyone to be aware of, is that sometimes abuse and can be more common when people are pregnant, and it's important to have healthy and safe relationships. And so if it feels like there's arguments or fights or high stress in relationships, or that you don't feel safe at home, talking to someone you trust, talking to, and your doctor can be one of those people to help give support and find support in your community as well. And we can also give some resources for that too. But pregnancy can be a time of high stress and can be a time when there can be more violence or more abuse that happens. And so it's a time where we always want to be more mindful of supporting each other and safe during that time as well.
And something that can help you as well when you're doing deciding when to get pregnant is thinking about when's the best time for you and trying to plan accordingly. And we recognize that when someone chooses to become pregnant, it doesn't happen right away, and it can take several months in order for you to get pregnant. But thinking about what is the time span in which you are hoping to have your first child or another child, and talk to your healthcare provider to come up with a healthy plan. When we're thinking about people who've had children before, we usually recommend at least 18 months between births. So at least 9 months before you decide to get pregnant again. So that way your body has enough time to recover. And then there's also then better outcomes for both you and baby. And you'll have lower risks of things like infections or bleeding after you give birth. But it's about you. You're the one in charge, and thinking about what is best for you and your family when deciding to expand it. And we also wanted to include some additional resources for people. So Nurse Family Partnerships is a really wonderful group. It's primarily directed for people who it's their first time becoming pregnant or having a child, and they provide additional resources and information to help people get the nutrition they need when they're pregnant, as well as to help people get the nutrition they need for their infants. There's WIC, which is Women, Infants, and Children Supplemental Nutrition Program. They have offices throughout King County, and each of our clinics has an office either in the same building or in the building next to it, which can be a wonderful resource for people to get additional food. There's maternity support services through King County, and then we also wanted to include some of the exercises that you can do while pregnant to help strengthen your pelvic floor.
All right. So we wanted to try to keep the presentation part a little brief and give you all the opportunity to share tips amongst yourselves, ask us questions, or clarify anything. So the floor is yours.
All right, ladies, ask away.
And we also wanted to mention, we were talking a lot about this, but we're hoping to continue to come as guest speakers maybe once a month for the next few months. So if there are topics that you're interested in, please let Salad know. We can do a little series. This one could be preconception counseling, and then the next one can be, what to expect in the first trimester. Oh, we have a hand. Please go.
Yep, that's Ayan. Go ahead, Ayan. Oh, poor baby.
I didn't hear the rest of it, but I just had a question for that. And also, someone who has thyroid and hormone, what do you recommend for pregnancy? They do.
Oh, she'll call back. I just resent her the link because she texted me to ask to resend her the link because she was having a hard time. So she'll call back. Yeah. Oh. Oh, she'll back. Any other questions, ladies? Because I have a bunch and I want to give you guys a chance to ask because you guys are the guests.
I have one question.
Naima, so go ahead, Bayo.
Hey, Bayo, how are you?
Alhamdulillah.
You were talking about folic acid in the prenatal vitamin. I hear a lot that folate is bad for you, and that folic acid is bad for you. You should take folate instead. Could you talk about that and which one usually people recommend?
Oh, that's a baby cute.
Oh, sorry, I got another call.
Don't worry.
Yeah, that was the question.
Sorry, I was muted. So we often think of them as being a little bit interchangeable in terms of what they then do inside your body. People often think that folate is what's more found in like leafy greens, what's more naturally found in fruits and vegetables, and then folic acid is what's in the supplement. Once they're inside your body, they're both used pretty much identically in order to help with brain development for your baby. And so always it's better to get things through food and eating a nice, healthy, balanced diet, but we also recognize that that can be difficult. And so supplementing with a prenatal vitamin that also has folic acid is a really great option. And I have not heard of any harm coming from people taking folic acid as a supplement, but we do know of the harm of people not getting enough folate or folic acid.
Yeah, I think the trickiest thing about what sometimes people worry about is the quality of the folic acid. So folic acid and folate are chemically the same. Folate is just naturally occurring in foods, whereas folic acid is man-made. I think that's one of the things to look for when you're looking for vitamin brand, but not even just vitamins, just any kind of supplement. It's not regulated the same as food, or it's not regulated the same as drugs. And so making sure it's not just a prenatal vitamin you find at the dollar store or something, making sure it's a good, reliable brand. Sorry, Amelia, were you about to jump in?
I was going to say that sometimes, I'm not sure if this is what you've heard, but sometimes at really, really high doses, folic acid might cause some side effects or some discomfort. But the amount that we recommend people who are pregnant or before they're pregnant are taking are not in that range. And the amount that's in prenatal vitamins as well is not in that range. And when you become pregnant and if you have conditions or your doctor is recommending that you need to take more, sometimes that's because your body might be kind of consuming more. So that might be part of what was behind what you've heard. But let me know let us know if you have more clarifying or more examples of the harms that you've heard, and we can try to talk about those too.
Thank you for your question.
Thank you.
Can I ask a question about the prenatal the folic acid that the moms take? I have seen, as a doula, I've seen a lot of moms complain, like when they take them and they have a morning sickness, they stop taking them. And it's hard for me to have them get back to them. What do I do to make them take it back again? And sometimes they complain about the size of it. They say it's too big for them to swallow it, or the smell. So
that is such a good point, and something we see all the time, especially when people start having morning sickness. Your sense of smell gets so much stronger during pregnancy. And so sometimes it can be trying different brands to see which one works best for you. There's ones that are tablets and there's some that are capsules. And the capsules are the ones that have the little gel coating. And for some people, having that gel coating is helpful because you can't smell the pill as much and you can't taste it as much. And so for some people, they find that to be really beneficial. Taking it earlier in the morning, sometimes people find helpful. Some people find that they have to take it later in the day if their morning sickness is not as bad. Some of the pills are really big. If it's a tablet, you can cut that in half and take half now, half later. Because they're big pills because there's a lot of nutrients in them. And so finding a way that works for you, a tip that can help people swallow pills if they find that they have difficulty. Often people, when they think of swallowing pills, they think, oh, we need to tilt our head back because then it's a straight shot down. Often most people find it easier to tilt your head a bit forward when taking a pill, and it makes it a little bit easier to swallow. And so trying different tips like that, trying different brands. Some people end up going with the gummy vitamins to help with that, although those usually have a little bit less iron and a little bit less folic acid in them. But it can be hard. Sniffing alcohol wipes, like the kinds that you clean your cell phone with or the kinds you see in the hospital, that can help some people with morning sickness, and doing that while taking a pill or drinking some ginger tea while taking the pill can also be helpful because those are all things that settle the stomach, but it's incredibly common for that to happen.
So Ayan, you back up, Abayo. Are you good to go? I told her to call it in.
Ayan, if you want to text your question or type in your question too, then if you're having trouble with your audio or something, then we can answer.
Call in text. Anybody else have a questions?
I have a question. Hi, everyone.
Hi.
Hey, Kimberly and everyone else. Sorry,
Good to hear
I'm
from
like
you
in the middle
again.
of something. I don't want to have my camera on because I'm not decent. But I wanted to ask about the use of marijuana, like especially in early pregnancy, for like morning sickness stuff. What are you all telling your clients about that? Because especially now that it's legal, more and more people are wondering of indulging it, especially to help with like appetite and and all that stuff. What do you all have to say about that?
Okay, so we, I think we might possibly all have different opinions on this. I think the use of marijuana kind of pre-pregnancy, during pregnancy, and after pregnancy all kind of vary. What I think about is like, okay, what are our main goals? Our main goals is to keep mom healthy and keep baby healthy during pregnancy. Let's say mom has been losing weight during pregnancy because nothing is working. Every nausea medicine, we've tried every tea, every lifestyle modification, nothing is working. And then all of a sudden mom tries like a marijuana gummy. And that is the only thing that helps her keep any food down, keep any nutrients down, get any amount of sleep. Then in general, I would say you have to do what works for you. And if that means that like you will take this possible risk, that it may affect baby, but the benefit is that you're able to provide nutrients for baby because this is the only thing that has helped you. Then I say, the benefits outweigh the risk. I think it's a conversation to be had. I think it's a similar conversation with breastfeeding. We usually say, breast is best, but some people worry, like, oh, well, there might be a little bit of substances that can carry through the milk, but also the breast milk has really great antibodies that can protect baby. It has excellent nutrients that can help baby grow. So I think it's kind of that risk benefit conversation that you have to have not only with your provider, but also with yourself and your family and whoever is involved with nurturing baby. I think in general, if people decide that that is something they want to do, I personally take kind of like a harm reduction model. So in general, there are multiple ways to consume marijuana. You can smoke it, you can vape it, you can eat it, you can do tinctures, you can do topical things. And so in general, I tell folks if they decide that they want to continue their use, whether it be for stress management, whether that be for like anxiety or appetite stimulant, to do something that is a little bit more predictable to keep not only themselves safe and baby safe, and what I mean by that is, for instance, like edibles are okay, but we can't really predict what the timing of the effect. And like I usually generally say to avoid like smoking or vaping, just because the effects that they can have on your lungs. Tinctures are usually a good approach. And I think depending on what the reason why they're taking it, trying to look at the different components, is this heavy in THC or is it more CBD? And making sure folks are buying it from, the stores instead of like online or on the street. There are really weird products that are online that use like a bunch of pesticides. And so trying to go the organic route if you can. So the short answer is you have to do what's best for you and your baby. And if you can find other ways to address your symptoms besides marijuana, I think that's generally safer, just because there's a lot of research that is being done. It can be a really great resource, but there's also a lot unknown still. I don't know if Amelia and Maya have other takes.
Yeah, I think you really said it the best. of there's a lot we don't know still. And part of that is very few people are going to do research studies where they give half the people marijuana, half the people not, which is often what we consider the gold standard for seeing if something is harmful or helpful. And so we don't have as good of data, but also recognizing that for some people, if this is the only thing that can allow you to get the nutrition you need, it's really a risk-benefit discussion to have with your doctor and to think about what's best for you. But I don't have a blanket statement for everyone besides if you are using to try and get it from a more reputable source, and to eat or drink is safer than smoking or vaping.
Awesome, thank you.
Assalamu alaikum.
عليكم
Sorry,
السلام.
I tried to call and add, I just called in. This is
No problem. Anybody have a question? سؤال قف قوم ما كجرو هداذن قرنين حتى في سومالي وكو ترجمانينا إن شاء الله.
Sorry, I want to ask a question. Hey.
Yes, go.
Excuse about I'm at the park, so if you guys hear a lot of noise. My question was earlier, is there a way to avoid having incontinence cervix, or have what do you call it? When someone is trying to conceive, before they conceive, is there a way for them to avoid incontinence cervix, or is there something that I should try before that? Maybe it doesn't. I don't know if it makes sense, but I just
Can I ask you just
find out.
Yeah, can I ask a clarifying question? Do you mean something you can try to prevent going into labor too early because your cervix is not strong enough? Or is that what you're asking?
It has to do with what I noticed. It has to do. It started very early in the pregnancy, which is around like a month. Basically, yeah, you get a shortening of the cervix, and that's what actually they diagnosed me that I have incontinence cervix. I'm not sure if it's only one-time pregnancy because it's the only one that I had with.
So I think that's a really wonderful question.
And I had an incontinence cervix on top of having a cerclage.
Mm-hmm. Yeah, that's really tough. We don't have much recommendations for preventing it in the future. Besides, if you've required a cerclage in the past, we'll often recommend that you get a cerclage again in future pregnancies, depending on how long they measure your cervix to be. But I don't know of any supplements or any exercises that you can do prior to being pregnant that can help prevent it. It's often, it might just be something that your body does. But the cerclage sometimes it's really one of the best tools that we have that can really prevent people from losing their pregnancy and being able to carry a pregnancy to term or close to term, so that way they can still have a healthy baby.
And this is something that is so important that you talk to your doctor about before, or as soon as you find out that you're pregnant, because this is something that they might want to measure your cervix at earlier ultrasounds and keep track of how long it is looking, and then possibly giving you either medications on the cervix or doing a cerclage. So it's important to talk to your doctor that you've had this in the past, because sometimes, even in the first trimester, there might be either measurements or other interventions that they might want to try. And so it's always important. And with anything else, if you've had complications in your pregnancies, in your past pregnancies or deliveries, it's always very good to talk to your doctors about that, because oftentimes things you might be at higher risk of those things happening again, but you have time if you talk to your providers, and they can help plan to prevent any complications from happening again, or try the best to help protect from from any complications.
Yeah. And adding to that, something that can help prevent complications such as preeclampsia is early on in pregnancy, you might want to talk to your doctor about whether aspirin and taking an aspirin daily is a right choice for you, because it is one of the few tools we have to prevent preeclampsia, which is also called toxemia, later on in pregnancy. And if you've ever had preeclampsia or you had elevated blood pressures in previous pregnancies, as soon as you're pregnant, talk to your doctor about whether or not you should be taking a baby aspirin a day to help prevent preeclampsia in the future.
I'm sorry, I didn't catch your names, but the weird thing about it that I'm actually sharing this information with you guys is my doctor did not actually recommend that I get a cerclage to begin with. And I've lost a baby before I had my son right now. And I've just pursued with them that I insisted that I wanted a cerclage. And I think with the grace of God, and I think doing that cerclage and having to have progesterone is what actually lost my pregnancy, because I've lost 5 pregnancies before him, and that a lot of the doctors that I've seen were insisting that I don't need a cerclage, and there was nothing, they were like, how do you know that you need a cerclage and stuff? It's just what I read online, and people who have similar issue that I have, and I was just persistent with that, and I think I got a cerclage at about 14 weeks. And then another 19 weeks is when they find out that I have incompetent cervix. So a lot of times doctors or whoever you deal with are not very well wanted to do things, and and if you listen to them, sometimes you just have to still know what you wanted. And this is just going through research and going through online is how I didn't even know what cerclage was, and because of that I was just wondering if I even wanted to try it again, if it's something that I could avoid doing it, or is there something that I can take it or prevent it. But I do appreciate your answers.
Thank you for sharing your experience with us. Again, I'm sorry for your loss, and I think you are teaching us a lesson and kind of helping others as well, kind of recognizing you are the person in charge. And I appreciate you speaking up and sharing about that. And I hope for all of you for future pregnancies, if you are uncomfortable with someone, it is your right to speak up and ask for medical care. And that's something that we will carry forward with us as well. I think sometimes, we have these algorithms or these protocols that we go through, but everybody is different, and making sure that you feel heard and that you're getting the right information and the right care for you is extremely important. So thank you for sharing that.
You're welcome.
All right, any more questions, ladies? Also, what other topics you guys would like to see in the near future? And I want to know what happens in first trimester, second trimester, third, pre-birth, what happens, false labor, all of the above. I don't know about you guys, but I want to know all of those things. Even though I'm a doula, I still wanted to know.
I think that's a good idea.
Yeah.
A lot of things to do with women and.
Mm-hmm. Oh, somebody says breastfeeding. Oh yeah, breastfeeding. Yeah.
Assalamu
Alaikum.
Hi, everyone. Thanks for coming, doctors. I just had a question. I wanted to go back to your presentation. I'm not sure if you touched on this, but was there anything about genetic testing before conception? I mean, that includes part of the preconception period for both parties?
We didn't talk about it, but that's a really wonderful question that we really should have included. So thank you for catching that. Yes, you can talk to your doctor about different genetic testing, especially if you have something that runs in your family or something that runs in your partner's family. And there's different ways to do that, both through your doctor as well as through outside companies that do genetic screening and seeing. You can talk to your doctor to find out which option is best for you, which option is cheapest, because unfortunately sometimes it is more expensive to go through the genetic counseling through your doctor as opposed to doing something like 23andMe or Ancestry or the many different other companies that exist. But especially if you've had a child in the past that may have a genetic condition, if you have any relatives that have any or anything runs in your family, it can be a really great idea.
Thank you. And just to piggyback off of that, also testing for like for both people, I guess, you know, the ability or inability to get pregnant, or like how that can be supported and what resources are available for people like that.
That's a really wonderful question as well. We often think, depending on a person's age, that we assume that someone is fertile until we discover otherwise. So if someone, especially if someone's below the age of 35, we recommend often trying to get pregnant, and that can mean having sex every other day instead of every day, allowing the sperm to mature a bit, making sure that you're having sex right around the time of ovulation, and with the ideal times being like the day before and the day of ovulation, so that way the fertilization occurs in the tubes and it can then make it into the uterus at the right gestational age. And only if you don't succeed in getting pregnant do we then often recommend evaluation for fertility. And part of that is a lot of the fertility evaluations are quite expensive and most people don't have issues. And so to avoid what can sometimes be thousands of dollars of testing, that we first like people to try and get pregnant kind of the traditional way. However, if there's evidence that you've had difficulty in the past, if you have gotten genetic testing and there's concerns that you think, oh, maybe we need to do IVF so that we can test the embryos to avoid a certain condition, those are all things to bring up with your doctor.
Thank you so much.
And then if you're also someone who doesn't have regular periods, for example, if you only have periods every 2 to 3 months, or your periods are much shorter or longer than expected, or you have periods lasting several weeks, talk to your doctor before you get pregnant, because there may be a concern related to your fertility, and there may be medications that they can use to help you get pregnant. There may be medications that they can use to stimulate ovulation, or to fix an underlying disorder that may be causing the irregular periods. But if you are someone who has regular periods, we often assume that you are fertile until proven otherwise.
And that can sometimes take 6 months to a year can be a normal time for someone who is fertile to get pregnant. And so if you are younger, younger than 32 to 35, we often say give it a year, and which can be a long time and can be really tough and stressful, but that it is a normal time period for people who are fertile to get pregnant in. If you're older than 35, often we want to give a little bit of less time, maybe 6 months, before we start investigating and doing tests to see if there's any problems with infertility. So just, I know when you want to get pregnant, it can be, we can be impatient, but at the same time, it's very normal for it to take many months.
I have Ayan's hand up. Ayan, go ahead.
Thank you, Sam. Doctors, I had a quick question. Since I have difficulty with periods, my period never comes on time. Even so, right now I'm like that, and I've struggled with thyroid, which I found out 6 years ago. Before that, the primary doctor that I had would always tell me I don't have thyroid. But then about 7 years, I'm taking a thyroid med. But I also know that I have deficiency of hormone deficiency, which I don't know, like, if there's like a particular one or a way to find out. I've been trying to, research about, find out, with my period being like, even after I gave birth and before that, it would always last like 2-3 months later. I tried diet, I tried a lot of stuff, and still it would never get into like regular cycles. And trying to conceive again, it's been a difficult. And I've had an ovulation kit that I've listed as even with ovulating days that I ovulate, still even if I try that way too.
Ayan, can I ask, do you have any prior children?
No, I have like 6 pregnancy, and I think only my son, he's 4 now, is the only live birth that I have. All of them miscarried. And with him, the pregnancy before that was like, before I got conceived him was like, I lost at 4 months. I went to a doctor, and he found out that I had once I conceived, it was actually a doctor, because I was just struggling, and when I did an IUI the previous pregnancy, and then when they were monitoring me, they said there is nothing we can see right now, but once I conceived, they realized that I have a progesterone issue, and that I took some suppository progesterone until I was like 10 weeks. And then they told me to go follow up after that with a regular gynecologist. And I'm there. And then at 12 weeks, okay, home. The gynecologist told me that I don't need it after 12 weeks. And then he told me to stop the suppository. And I did stop. And then at 14 weeks, one night I just had, my water broke out of nowhere. Sorry, I'm at the park. But yeah, but then my son, I continued taking the progesterone suppository up to 16 weeks, and then they transferred that. After that, I was getting a shot, weekly shot, and I made it through a full term with him.
It sounds like you've been through a lot, and that I'm so sorry for your losses. And it sounds like the pregnancy that with your son was also very challenging, just going through all of those treatments, and it sounds like, I'm not sure exactly what the hormone issues are that, I mean, besides the shots you were getting for the cervical insufficiency, but the fibroids can cause irregular periods, and can, if they're large, can cause some complications with pregnancies, and then different hormone imbalances that can affect the regularity of your periods can also make it difficult to conceive. So sometimes it's about, and I'm not sure if you've gotten specific tests to figure out which ones might be causing those, but it can be really challenging to deal with those things, and to successfully conceive.
Yeah, I've never done any tests and find out which hormone it is, but prior to I had a heavy bleeding over 16, 17 years ago, and then I had a gynecologist that looked at it and told me what was causing was I have a tulip, they call it. I think it's not a fibroid, but it was a polyp that I had, and it was removed. And after that, my period was like regular for about a year or 2 years, but then it came back to being irregular. Hold on, I'm on the phone, okay? But I never find out, and I was always wanted to find out what is the cause of, like, what kind of a hormone deficiency that I have. Can you sit? Sorry.
Yeah, that is it's hard to know, besides kind of getting more of like a further personal history, and doing laboratory testing often is kind of when you can figure some of those things out. So I know it sounds like you've had some experiences with doctors that have not necessarily answered your questions the way, or kind of given you answers or given you the things that that have worked. And so there are a lot of different types of doctors and a lot of different doctors, and sometimes it's about finding who works well with you and someone who you feel like you have a good relationship with. Some doctors aren't good at listening and aren't good at don't always listen to you and what you want, and it sounds like you're very good at standing up for yourself. So I would recommend, talking more with either a primary care doctor or a gynecologist to answer some of these questions that might be more about doing some tests and things like that. But it's hard sometimes to find someone who will spend the time and listen really well. And I'm sorry that you've met people who haven't done that for you in the past.
Yeah, I just wanted to add. That.
Thank you.
There are fertility specialists that also could, perhaps help in like doing the proper blood work for just finding out exactly what hormones are imbalanced, and then sort of letting you know what the treatments are, because not every doctor is also versed in that in that area too. So I think finding someone who specializes in that would be significantly helpful to you, Ayan. Yeah, but it's really, it's sorry for your losses, but your persistency and, now you have a beautiful 4-year-old, so yeah, but which means that your body is capable if you just, have the right like guidance, I guess, in providers.
Yeah, and please feel free to reach out to us if you guys ever have questions about going to a specialist, or what resources are good for any of your questions. We are in touch with those doctors and can connect you with the ones that we know personally and feel like they're good listeners and can meet you where you're at.
I appreciate it. Thank you so much. I'm sorry I'm being in and out, taking my to the park and we're just like, but I do appreciate all of your help, and I am looking forward to seriously. It's always been a difficult finding the right doctor, and a doctor, as you said, that listens to you, and a lot of times I would think that if it has to do with insurance, even I have the most expensive insurance, even having a good insurance and going to the the ones that I think that I Googled the best doctors that can do, would all say there's nothing wrong, and it's just been that I always go there and I said I want this done, and that's what happened most of the time. And I guess whatever I read, and thanks to those who do reviews and stuff, sometimes it's helpful, like when you see someone like you who write about it, and with that, that's what actually kind of guide me. All the doctors, I even went to different states for doctors just to kind of see someone that would just take time to research it and find out what's going on. But thanks, hopefully I'll keep, and thanks for all of this information. Seriously, a lot of times without this kind of information, you don't get anywhere with anything. Thank you, Saad, for bringing these doctors and all of these experts that can give us every information that we're looking for. And I'm looking forward to hopefully keep in touch with you guys too, doctor. Thank you. Okay, Mama.
Definitely, Abba. I got you back. Don't worry about it. And I got all the information you need. Don't worry.
Thank you.
All right, ladies.
Sorry, I didn't want to be the only one talking today.
Oh, no.
Somebody has their
This
hands
is a
up.
very
I'm glad.
This is a very big subject for me, but thank you.
I know, Bio. I know. No, this is good. I'm glad you were able to, speak out about. This is what we have this platform for. If we can't talk about here, where are we supposed to be talking? This is good. Thanks, Bio. Thank you.
Definitely. You're welcome. Thank you.
So at the beginning, we talked about, ladies, having these doctors back in the near future, maybe once a month, and topics that you guys wanted to know. I said a few things, but I wanted to hear it from you guys before we end the night tonight. What do you guys wanted to hear? What do you guys wanted to, see that these doctors, you wanted them to talk about it? Don't get quiet. I got my list already. I don't know about you guys, but I got my list.
Should I pull the list that Kimberly sent me and then just read through it and see if there's anything
Sure.
they want to add to?
Pull it up. Yep. In the meantime, while Faiz is pulling out, you guys have anything special you guys wanted to add it to that list? It might be in there too.
I would say like the importance of a strong support system, especially getting the dads involved. So I think for some cultures, just making sure that the dads have, how do I say, like feel like they're a part of it, or the moms advocating for themselves, for dads actually to partake in it, and not just show up at the birth.
Yeah, that makes sense. Yeah.
Cool. So, so then how would you put it? Like,
Cultural awareness for dads, something like that.
how would you word that? Yeah.
No, I'm not sure how to put it, but just really partner support, or like, I don't know. I would have to think about how to really put that.
Okay.
We can even do like a general like how to set up your like support system during your preconception period, during your pregnancy and after your pregnancy. I think
I like
even
that.
even if people don't have like husbands or wives or partners, they hopefully often have either friends or family, and there's so many ways that you can be supported, and it's always so hard to overtly like have to ask for it.
Yes.
But we could definitely come up with like a bunch of like techniques and things to set in place kind of throughout that period, that you can like literally just give your family, friends, partner to be like, this is how you can support me.
Yeah.
Okay. How to include labor plan with partner. I like that one. That was Fortune. So I like that.
Oh, sorry, I'm not looking at the chat. Okay, should I read the list?
Natural contraception. Oh, good luck on that one. I mean, that's good. I love that one.
We could definitely talk about natural family planning and what that means.
Yes.
That's Sister Aisha's segment. What are you doing, Taylor? I'm just kidding.
No, that's a good one. That definitely is a good one. Yeah, because we do have we had the list, contraception in general, non-hormone, natural family planning, all that stuff. So that is on the list. Menopause is on the list, and perimenopausal.
Yes, perimenopause and menopause. Yes.
Yeah. So postpartum counseling, cancer screening, mental health, general pregnancy.
Breast cancer, self-screening for breast. Something that we don't do it often as a woman, especially color women.
True. Yeah.
Childbirth education classes.
What are the to-know things that you doctors wished your
postpartum
clients had prior to coming into labor? And we need to let you all go because it's past 6 o'clock. I know.
Pelvic floor exercises.
Yeah, that's huge.
Okay.
Also, especially if they're coming in for an induction, but sometimes labor can last a really long time, and pushing can be several hours.
Yeah.
And it's not like in the movies where, you know, 2 pushes babies out, because that would be such a boring
Can't be
movie.
looking pretty.
Yes.
It would be, it's such a boring movie if it were pushing for 3 hours, but the whole process can take a lot longer
Mhm.
than you expect. And so be patient with your body, be patient with your baby. It's the two of you working together for
Mhm.
baby to come out, and really understanding that the goal for people is that you are healthy as well as your baby. And if for some reason the topic of a C-section comes up, or the topic of a vacuum, or something to help get baby out because something, we're worried as doctors that something could be going wrong,
Mhm.
that even if you have a C-section, you still gave birth. It's still just as much of a birth as it is if you have a vaginal delivery, and that and that things can take a long time, and that it can sometimes feel like you're just waiting for hours for your cervix to dilate, or you're pushing for a really long time, and that can be very normal. And it's giving your body that time to do what it needs to do.
Mhm.
I think that's one of the biggest things when people come in to labor, just knowing that it's going to be a lot of hurry up and wait and hurry up and wait, and that to have patience for your body to do what it needs to do.
It's a good one. Yeah.
Also, if you deliver at Swedish, order the milkshake as soon as you deliver. It's the best thing on the menu. It's very delicious. And I want you to enjoy that.
I see labor plan with partner, and then also birth plan on the list here, and 2 separate people brought it up. And so I think, you know, and kind of what Maya is saying too is we see a lot of people, we're all at Swedish, a lot of people deliver there. But what sometimes the medical system and the patients can be maybe not communicating or not having the same expectations about how that experience is going to go. And I think as healthcare providers, we can do a lot better at talking through expectations and just making it a more comfortable, less anxiety producing experience, especially if there's any complications that can be scary. And so maybe we can talk through, you know, different types of deliveries or different types of labor that, you know, the labor process happening at home, happening in the hospital, kind of what our experiences or what we might be thinking of as doctors. But also you know, selfishly want to learn from all of you too, because you know, what your experiences have been like and what you wish that your doctors would do differently. And from doulas of what your experience has been like as kind of the folks who communicate between the healthcare providers and the patients, and what it's like when you're laboring at home with your patients, because we don't do that either. So I would love to have a session where we could, or a couple of sessions where we can talk about just the labor process.
Yeah, I like that. That'd be great. Yeah, that's actually awesome. I would love that.
Can I add one thing? Sorry, guys.
Yeah, go ahead. No, don't be.
I love your plan. I was thinking maybe like extending it to like the routine check-ins, the monthly and the weekly. I think those conversations that patients and midwives are having, that is also sometimes dramatizing for individuals that don't speak the language. And I feel like sometimes doctors do use that scare tactic. So maybe that could be added to that list.
I love that idea. Yeah.
That's good.
Thank you.
Yeah, that's good, Fartun.
It happens.
She said it happens. Zahra say, stick to your birth as much as possible. Be patient with the process and trust your doulas. Ooh, I like that one. That is a good one.
Sounds like a doula wrote that one.
That was
no biases.
No, birth is very fluid, as you all know, right? Yeah. Birth plans are great starting point, but
it never happens.
Things shift like during birth. So also just being able to be flexible is also good. Birth plan is a starting point, but also being flexible, because I've seen people who get disappointed at the end because the birth plan didn't
happen, yeah.
you know, take shape or how they expected it. So birth plans are definitely a starting point for conversation between providers and the clients. But at the same time, we should, you know, like if you have a natural birth in mind and things shift and you ended up having cesarean or you ended up having a vacuum, at the end, mom and baby are okay. That should be like the goal. You know what I mean? Like I think I've seen the people who are more open to things shifting are the people who are very much satisfied with the outcome, rather than someone who feels like I wasn't, you know what I mean? I wasn't allowed to do X, Y, and Z, and that was in my birth plan. So yeah, so that's the piece I want to say about birth plan.
Okay. Somebody asked this one last question, says somebody who's trying to get pregnant, can they get a COVID vaccine before they get pregnant? Yes. Okay.
Yes, I would definitely recommend before pregnancy. And I want to see what Maya and Kim have to say about this too, but even during pregnancy, I would say that getting a COVID vaccine is a good option, because getting COVID has much worse outcomes for pregnancy than the vaccine. And the vaccine, although we don't have a lot of information on, it wasn't tested in pregnant patients, which is unfortunate. But many things are not tested in pregnant patients because we don't want to potentially harm pregnant people. But I know personally people who are pregnant who've gotten it, and I would definitely recommend before or during pregnancy over not getting the vaccine and possibly getting the COVID infection.
I agree. All right, so once a month, I think we should schedule for you guys to come back and to do this series of stuff. Yeah.
Thank you so much for everyone's participation. It was really such a pleasure to be here and hear your questions and comments.
Yeah.
We really appreciate.
Yes, thank you so much for having us and allowing us to be a part of your community.
Thank you. Thanks for coming. It's nice to have you guys in this space. Thank you. And thanks for coming, ladies. I know tonight we went over. It's amazing. I never know this hour. It goes past so fast. Anything else, ladies, before we close out tonight? I know it's Saturday. You want to go back to your families. I want to let you go. I will see you all next Saturday, same time, 5 o'clock next week. I'll let you know, guys, what the topic is going to be, inshallah. And if you have anything you want to text me. Thank you, ladies. Thank you so much for coming. We will continue this in email, inshallah.
Definitely. Yep. Thank you all.
Thank you, guys. Bye.